vascular disease is a slow and progressive circulation disorder. It may affect any blood vessels outside of the heart, but most frequently it affects the arteries and veins in the legs. Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to go over another quick 5-minute mind map of peripheral vascular disease. We're specifically going to be talking about the differences between arterial and venous disease in the leg and what we will see and how we can visually tell the difference. Okay, so let's start with arterial. So arterial is the blood vessels that carry the oxygenated blood to our body parts. Okay, so to our feet, because we're talking about our legs here. Now, if we're not getting enough oxygenated blood to our feet, we're going to start having problems. So what are we going to see with arterial disease? Shiny, hairless legs. So they're not going to have hair on their legs and they become very shiny. They're cool to touch. It has a diminished or absent pulse, intermittent claudication. Ulcers on their legs will have this punched out look. They're very symmetrical and it's a punched out look. And then you can also have gangrenous. So their toes may become gangrenous, black, if they're really not getting enough oxygen to the toes. Now, next we have venous. So with venous, we want to elevate the legs because the blood flow isn't going back up the legs to the heart properly. With arterial, we want to dangle them down to make sure that that blood is getting to the feet. Venous, we want to have them elevated, okay? So the blood flow going back up to the heart is impaired. So what will we see with this? Brown skin, edema, so they'll get these big legs, okay? The fluid is just sitting in the legs. When the fluid sits there, it can cause ulcers. They should have a normal pulse, but they will have these irregular shaped ulcers, okay? So arterial, you have these punched out looking ulcers. With the venous, you will have these very irregular shaped ulcers. Compressions are needed with venous insufficiency. Now, we always need to make sure that we're doing an ankle brachial pulse index to make sure that the legs can withstand compressions, because sometimes we are seeing mixed where they have arterial and venous disease. Okay, so we have to make sure that we are checking, making sure that they can withstand compression. And with arterial disease, automatically, we want to be sending them to a referral for a vascular surgeon to possibly see if we can get the blood flowing through to the legs better. All right, guys, so that is your 5-minute mind map for peripheral vascular disease and seeing the actual difference between arterial and venous disease, which we see most often in the legs. So these are the differences. All right, guys, but that's all I have for this video. I hope you did find it helpful, and I hope to catch you in my next one. Bye for now.